Hello and welcome to The Art of Aging, part of the Abundant Aging podcast series from United Church Homes. I am Beth Long-Higgins, the director of the Ruth Frost Parker Center for Abundant Aging, and I am your host for this conversation. On this show, we look at what it means to age in America and around other places around the world with empowering conversations that challenge, encourage, and inspire us all to age with abundance. Our guest today is Dr. Leonardo Porcini. Leo is professor and chair of Preventive and Community Dentistry at the Iowa College of Dentistry and Dental Clinics. He is also president of the Special Care Dentistry Association. Leo teaches pre-doctoral students in the Geriatrics and Special Needs program and treats patients in the general faculty practice. He also acts as a general practitioner with an emphasis in geriatric dentistry. Leo's current research focus includes geriatric dental and general health epidemiology and satisfaction of prosthodontic, I can always trip up on that word, patients. Dr. Marchini is also interested in researching about the very best way to teach dentistry with particular interest in geriatric teaching. Welcome, Leo.
Thank you, Beth, for the wonderful words of introduction. I really appreciate it.
So our topic for this podcast is prompted in part because we are having this conversation. We're recording this podcast exactly 2 weeks before our annual symposium with the Parker Center. And the topic this year is dismantling ageism, how prejudice, stereotypes, and discrimination based on age affect us all. If you'd like to find out more information about the podcast, you can go to our website, abundantaging.org, and click on the events and conference tab, and then the 2023 symposium page will pop up there. So just to recap a bit, on our earlier podcast, Leo and I had a conversation learned about special care dentistry. Could you just explain briefly again what this is?
Absolutely, Beth. Great question. Geriatric and special needs dentistry is the area of dentistry that study and provide care for frail and dependent older adults, as well as adults with special needs. So as people age, thankfully, most people age gracefully, which means that they age healthy and enjoying life. But some of us would age with some important chronic disease that will bring disabilities, and they might become frail and dependent on others for many activities of their daily living. So for those patients, some dentists have advanced training to provide appropriate care for that population. That's it in a nutshell.
Okay. And obviously there's a lot more to that. And if you'd like more information, you can listen to our other podcast conversation for our listeners. So when we were prepping, though, for our podcast conversation, I was really surprised that ageism is something that is recognized as an issue in oral health care. I know that ageism exists in healthcare in general, but I just had not thought about how that manifests itself in dentistry. So can you break this down a little bit for us? Where do we see ageist behaviors? And just a reminder to our listeners, ageism is how we think, feel, and act towards ourselves or others negatively based on age.
Yes. Beth, this is such an important topic that the WHO, the World Health Organization considers it one of the most important barriers for older adults to receive age-appropriate care. It's ubiquitous. It's everywhere in the way older adults are depicted in the media, the way people talk about older adults, the way older adults are treated in the workplace, and it's no different in the healthcare system. And oral health care is part of the healthcare system, and it happens in the dental office as well. How does it manifest in the dental office? Well, in the dental office, it can come in very subtle ways, like instead of presenting implants for an older adult, we can present only complete denture options for older adults because we don't think they would have the finances to, pay for implants just based on age alone, right? Sometimes we can inadvertently, not offer static options, cosmetic options for older adults because we might think they are not interested because they are older, right? So options that would have been offered to younger adults are not offered to older adults just because of their age, right? Um, so those are subtle ways that it can manifest in oral health care. Other ways it might more explicit ways it can manifest in oral health care is that some sometimes when older adults are seeking care, the dentist may not want to keep treating those patients because they feel that as they are getting older, they are not able to cope with them health conditions and medications that the patient are taking, or because they think that those patients are not being able to comply with advice anymore or things of that nature, which becomes like more visible, but at the same time includes a component of dental education to it, knowing how to deal, knowing how to do it. That brings us to another way ageism affects oral health, is that because a lot of dental students, once they graduate, they don't seek advanced training on how to treat frail and older adults, sometimes unconsciously, just because they don't want to deal with that population. Not because they are they have an conscious prejudice about it, but
Right.
because of the unconscious part of ageism that's also very, very prevalent in society, and they are not even aware of it. That's why it's important to raise awareness about ageism among dental students.
Absolutely, and that's an important step. And so glad you're doing that. Hey, since we last had our conversation, I came across an article that was highlighting the significant work that's going on right now. And popular in the culture amongst folks in their 20s and 30s. Do you think that this trend to whiten the teeth or to have cosmetic procedures done to the teeth when we're younger, do you think that that's based on ageism because they know that our teeth yellow as we age, and so they're wanting them to look as white as possible? Do you think that that's all connected?
I think that certainly there is a connection there. There is a link there. As you think about all the anti-wrinkle, all the,
Exactly.
all the, hair dyeing, products and all that. So there is certainly a link there, but there is also a very pervasive media stereotype, beauty stereotype that has
Mhm.
been uh, presented to society for a long period of time. So, just to put it in context, I remember when I was a kid, and one of the most beautiful actresses and actors will have smiles that were characteristic of them.
Mhm.
they were still considered astonishingly beautiful, but they had small tweaks to their teeth. A tooth that's a little smaller than the counterpart on the other side. How wide it was a part of it, but not so concerning. Now, if you look at the so-called celebrities around, they all have the same teeth. I mean, if you get a smile from this person, put on that other person, it is the same. And the shade is the same. And why is that? Well, because there is a standardized smile, as there is a standardized lip now. I mean, all, all people try to have a similar lip contour. That's not reality. And I am a little concerned about that excessive concern about aesthetics, right? That may bring unintended consequences to the future, because no procedure is riskless. There is always a risk to anything we do. So, I am going to do contact lenses in my teeth that are a fancy way to small veneers. They require no drilling. Okay, but you still need to prepare the tooth surface and bond it. And in a few years, if that person has a reduced manual dexterity, that may become a leaking margin. That leaking margin may become a cavity. That cavity may become a root canal. So, no procedure is riskless. So we need to be a little bit more attentive to the long haul, because now when someone do something on their 20s, that means that something needs to last 80 more years, 8 decades, right? Well,
Which
it may
reminds
not.
Which reminds me of our previous conversation when you were talking about your own experience of aging and how repetitive things that you did younger in life are having physical consequences now. And when you were younger, you never thought that that would have a consequence. That some of these things are going to have a consequence. And the ironic thing to me is when I look at the smile that everyone's supposed to have, I look at those folks and I think it looks like you're wearing dentures. Which then I automatically associate with somebody who is older, which is an ageist thing. I realize, but I think they're definitely not achieving the thing that they think that they're achieving. So it's just all very kind of ironic.
Right. Beth, we had a scale, color shade scale for teeth, okay?
Yeah.
That starts with A1, A2, B1, B2, C1, C2, D1, D2, and so far, okay? Well, that has been like that for decades. In the last few years, there were additions to that scale which are BL. BL is for bleached. So now we needed to add to the natural scale, to the scale of natural teeth shades, an artificial scale that's way whiter, that is for bleached teeth. I mean, why? Why whiter than what's the whitest normal,
Yeah.
right? I always question that type of thing. I think we need to be conscious about it. However, we of course need to honor the person's wishes as far as they are fully aware of the risks, right? But again, the influence that people have from the media may be taking away a little bit of their critical thinking about the consequences of it in the long run, and therefore, that's a really complex issue, because you don't want to not offer the services equally across the different groups, but you also want to counsel people about what's healthier and what's best without including any biases. So how we deal with it? I think the best way to deal with it is knowing your patient as a person, get that frank conversation among two people that are embedded on the best interest for the patient, and reaching an agreement that is good for the patient, right?
Absolutely.
That's the only way to go.
So, are there other things that you're doing as a professor in dentistry to help, besides helping to have dentists be aware of the own ageism that they've absorbed? Are there other things that are happening in the dentistry world to help raise awareness and to help pull down some of the ageist barriers?
There is a lot being done, Beth. That's a great question. So the first thing we started with creating a specific ageism scale for dental students because of the characteristics of what we do, the peculiarities of dentistry. It would be important to have a scale that measures things that are meaningful to the profession and touches ageism issues. So we look at that. We use that scale to figure out current ageism beliefs among dental students, or ageist attitudes among dental students, and then we tailor interventions during our educational process, during the dental training, to reduce that ageism. So we bring exercises that simulate certain conditions that are prevalent among older adults. We raise scenarios with different types of aging circumstances, so people can understand the why there are different attitudes regarding to the same stimulus, right? Why people will react differently, because they see that same circumstance under different lens. So we try to bring those lens to the students and simulate it. We also use standardized patients that, actor patients that would bring certain circumstances, certain life scenarios that the students need to navigate, and then we assess how the students did it and try to help the students having more tools to deal with the different aspects of it. So we do a lot of what we call simulation clinics for our students to experience how is it to live with a certain type of disability? How is it to go to the dental office with a certain type of disability, right? And we also bring information about the consequences of ageism in healthcare. We also bring awareness about, the fact that for many drugs that are commonly used, there are no clinical trials that were done among older adults. Therefore, we need to use them with caution, because we don't know the long-term consequences of those drugs and therapies. And same thing in dentistry. A lot of the clinical trials that have been done for restoration materials were not being tested among this population. So we need to look at it more cautiously, and many times we need to think about possible modifications of technique and all that would provide better results among that population, which bring us to more research about geriatric dentistry. That's another thing that we do here. We as we have a clinic that is oriented towards this group, we have data, long-term data about it that we can also use for research.
Well, Leo, thank you so much for all you're doing in the world of oral health, and especially all you're doing to help address the issue of ageism. And thank you to our listeners for listening to this episode of The Art of Aging, part of the Abundant Aging podcast series at United Church Homes. We want to hear from you. What's changed about you as you've aged that you love? What has surprised you most? And how do you define abundant aging, or who is your abundant aging influencer or hero? Join us at www.abundantagingpodcast.com to share your ideas. You can also give us feedback when you visit the Ruth Frost Parker Center website at www.unitedchurchhomes.org/Parker-Center/. And Leo, tell us again, where can people find you?
People can find me here at the University of Iowa College of Dentistry and Dental Clinics. My email is leonardo-marchini, my last name, at uiowa.edu. And I will be more than happy to take questions and help people finding providers on their area. Special Care Dentistry Association is another resource for that too. People can contact SCCDA, and they have a list of providers across the country that can provide specific care that people need as they age, especially if they become frail and dependent.
Thank you very much, Leo. This has been great.
Thank you very much, Beth, and thank you for your team who keeps the podcast going behind the scenes. And thank you also to our listeners. Without you guys, we would not be able to keep this going, right?
Absolutely.
Thank you.